Social Security cutbacks are causing disruption nationwide, and older Americans were never given a clear warning about what was coming. Officials presented it as ordinary budget trimming, but millions of people over 60 are describing it as something much bigger, a genuine crisis. All across the country right now, seniors are opening their mail and realizing their payments are smaller than they planned for. Social Security phone lines are jammed. Wait times have exploded. Local offices, the same places families relied on for decades, are shutting down for good. And the people least able to handle uncertainty are being hit the hardest. This is your retirement income. This is Medicare coordination. This is disability support. These are benefits you earned through decades of work. Even some Republicans, the same side that backed these reductions, are now voicing concern, saying their own voters are being harmed. When leaders from both parties start using words like chaos and crisis, you can't treat it like background noise. So what specifically has been reduced? How is it affecting your benefits right now? And most importantly, what can you do to protect yourself before things get worse? In this breakdown, we'll lay it out clearly. No partisan framing, no confusing agency language, just practical information every American over 60 needs to understand. How did we get here? The original Social Security promise. To understand what's happening today, you have to go back to how Social Security started. The Social Security Administration has been around since 1935. President Franklin D. Roosevelt signed it during the Great Depression, when millions of older Americans had nothing, no savings, no pensions, no reliable safety net. The program was created out of necessity and compassion. For nearly 90 years, it has been the backbone of retirement security for working Americans. You paid into it through your working years, and your employer paid in too. It was a commitment, an agreement that said, you work, you contribute, and when your working years end, support will be there. Today, that commitment feels increasingly unstable to many seniors. For decades, the Social Security Administration operated with thousands of employees in offices across the nation, from Maine to Hawaii, Alaska to Florida. These weren't just staff behind counters. They were people helping people. They guided neighbors, families, and friends through one of the most complicated benefit systems in the country. They helped individuals file for retirement. They helped families access survivor benefits after a death. They supported disabled Americans who depended on these programs to make it through daily life. And they did much of that work face-to-face, right inside local communities. Then the reductions started, what was cut and why seniors are struggling. What began as talk about efficiency quickly turned into something that has felt damaging for millions of older Americans. Supporters of the reductions argued it was simple. The federal government spends too much, and Social Security administrative costs are part of that spending. Cut those costs, and taxpayers save billions. On paper, it sounded reasonable. In real life, it looks very different when your local Social Security office closes permanently. And that's what's happening. Offices that served their communities for decades, sometimes 30, 40, even 50 years, are shutting down. Hundreds of locations, especially in rural areas and smaller towns. For many seniors, those offices were the only reliable place to get help in person. When they disappear, there may be no nearby replacement, no backup office within a reasonable distance, just a phone number that too often leads to endless hold music. What it looks like in real life, this is not just policy talk. This is about real people in real situations. Imagine you're 72. Maybe computers aren't as easy as they used to be. Maybe small print online is hard to read because your eyesight has changed. Maybe you're dealing with early memory issues and long forms feel overwhelming. You've been trying to fix a problem with your Social Security payment for months. You call the main number again and again. You sit on hold for hours, only to be disconnected before anyone answers. You drive to the local office only to find a sign on the door saying the office is permanently closed. Now what? Who helps you? Where do you go? That is the lived reality for millions of seniors right now, and it's not exaggeration. Advocacy groups, senior centers, and members of Congress have all described the same pattern. The disruption is real, the confusion is real, and the harm to vulnerable people is real. Even Republicans are pushing back. One of the most striking parts of this moment is that some of the loudest criticism is coming from inside the Republican Party. Elected officials who supported reducing government spending are now hearing directly from people back home. They backed budget cuts. They campaigned on them. But after returning to their districts, hosting town halls, and listening to constituents, many are saying a similar thing. This has gone too far, and it's hurting the wrong people. A senator from a rural Midwestern state described hearing from elderly residents who waited 6 months just to get a basic question answered. A representative from the South said their office has been flooded with calls from seniors who cannot fix disability payments, cannot resolve Medicare problems, and cannot reach an actual person at Social Security. When lawmakers from the same side that supported the reductions start criticizing them publicly, it's a signal that the situation is severe. Why this is bigger than a smaller monthly deposit? This problem goes beyond retirement checks. The Social Security Administration does much more than send monthly payments. It administers Supplemental Security Income, SSI, which helps low-income seniors meet basic needs. It oversees Social Security Disability Insurance, SSDI, which supports people who cannot work due to illness or injury. It manages survivor benefits for families after a death. And it coordinates closely with Medicare, so when Social Security operations break down, the consequences can spill into health coverage and medical costs. When funding is reduced, staffing is cut, and offices close, the impact doesn't stay contained. It spreads, it grows, and it hits the people who rely on these programs the most, often the oldest, the sickest, and those with the least financial cushion. Real-world consequences, overpayments, delays, and confusion. Let's talk about what this looks like day to day. One major issue is overpayment recovery. Sometimes the Social Security Administration makes a mistake and pays someone more than they should have received. When that is discovered, even years later, the agency can demand the money back. In the past, these situations were often handled with more care, more time to respond, clearer options, and a more workable appeals process. Now, with fewer staff, the process has become harsher. People are receiving letters demanding thousands of dollars with minimal explanation and limited time to respond. For someone on fixed income, a letter like that isn't just stressful, it's frightening. Survivor benefit delays are another serious issue. Losing a spouse is already overwhelming. At the same time, the surviving spouse may need to navigate the system to claim benefits they are entitled to. Before the reductions, the process could still be complicated, but it was more manageable with in-person help. Now, many people wait months just to have a case reviewed. Some are even hiring attorneys for issues that used to be handled at the local office. Medicare coordination has also become more chaotic. Because Medicare premiums are often deducted directly from Social Security payments, errors can bounce between systems. People are discovering incorrect coverage status, denied claims, and conflicting information, and fixing those problems has become extremely difficult. What you can do right now to protect yourself. Now let's talk about action. Practical steps you can take to reduce the damage if you're caught in this system while it's under strain. First, get your official Social Security statement. If you can, create an online account and review your earnings record carefully. Mistakes happen, and errors can reduce your benefit amount. Second, keep documentation of everything. Save every letter and notice. Keep copies of forms. Write down the date, time, and details of every phone call. That paper trail can matter a lot if you need to dispute a decision or prove what happened. Third, be strategic about contacting Social Security. Call early in the morning or midweek to improve your odds of getting through. If there is still an office open near you, an in-person visit may be more effective than repeated calls. Fourth, contact your member of Congress. Every representative and senator has constituent service staff who can help with federal agency issues, including Social Security. This help is free, and in many cases, it's one of the fastest ways to push a stalled case forward. Fifth, know your right to appeal. If you believe a decision is incorrect, you can challenge it. In many situations, you have about 60 days to act, so do not wait. The bigger picture. This moment raises a larger issue of responsibility and fairness. Social Security has long been considered politically untouchable because it affects millions of voters who understand how essential it is. Instead of cutting benefits directly, the reductions have focused on the machinery behind the program: staffing, offices, infrastructure, and operations. The assumption may have been that fewer people would notice, but people noticed, and frustration is rising. Final thoughts. Aging is already hard enough. No one should have to fight for benefits they earned through a lifetime of work. Social Security is not a gift, it's a promise, built on contributions made over decades. That promise must be honored. The encouraging part is that this can be improved. Funding can be restored, staffing can be increased, offices can be reopened. But it takes awareness and action. Don't stay quiet, stay informed. Hold leaders accountable, ask direct questions, and demand direct answers, and support one another. Share this with someone who needs it, because every informed person is one less person left alone in a system under pressure. You earned these benefits. Now it's time to make sure the system works for you.